Greetings, my name is Jose Gonzalez. The purpose of this presentation is to inform you of the history of assisted reproductive technology, expenses, three frequently used technologies, and how the process is performed in relation to infertile couples attempting to conceive. Imagine being told that you were not able to start a family due to infertility, and then stumbling upon an option that is similar to finding a possible cure for cancer. Now, I will introduce you to the world of assisted reproductive technology. This is some of the topics I will be covering today. The use of art dates back to the experimentations in the 1890s on rabbits, where a professor at the University of Cambridge, Walter Heath, did an embryo transplant. Art struck a worldwide interest when the Brown family completed an IVF process and conceived their child, Louis Brown, in 1978. Since then, people around the world have dedicated scientific study to the use of art for reproduction. WebMD defines infertility as the inability to get pregnant after having unprotected regular sex for 6 months to 1 year, depending on your age. Some of the factors of female infertility are polycystic ovarian syndrome, known as PCOS. PCOS is caused by the increase of cysts on the woman's ovary, enabling them to produce healthy eggs. Other factors of female infertility are anovulation, abnormal eggs, and uterine lining deficiency. Some factors of male infertility are low sperm count with abnormalities and low mobility. Other factors of female infertility are poor ovarian reserve due to the poor quality of the eggs and poor response to stimulation. Some of the techniques to battle infertility are in vitro infertilization, known as IVF. This is when you stimulate the female ovaries with medications, you retrieve the eggs, you use the sperm, and you fertilize the egg. You wait 3 to 5 days to see how the embryos start growing, and then you reintroduce the embryos to the uterus, and hoping for a positive pregnancy. The costs range from $6,000 to $25,000 per cycle. This includes medication, ultrasound, and blood work. Some additional costs can include the freezing of eggs if you have too many eggs, and the assisting of the hatching of the procedure. I have listed some of the medication on this PowerPoint. Another procedure is known as IUI. This is when you stimulate the ovaries, you use the sperm, you wash it, and you retrieve the best sperms available, and then you reinsert it in the uterine cavity using a catheter. Then you hope for a natural fertilization and implantation. The cost range is between $900 to $3,000, including medication, blood work, and ultrasound. The last procedure is known as ovulation induction. You stimulate the ovaries with the same medication and using natural intercourse and hope for a positive pregnancy. This cost can range from $500 to $3,000. Summary. I briefly explained some causes of infertility and defined infertility. I then described art and how helps the treatment of infertility. Art can be seen as an option to combat infertility. If you or someone you know struggling with infertility, art may have an option to help you, your friends, and family with conceiving and starting a family. Thank you.